The costs and pain associated with poor oral health have become a huge burden on families and the health system. So how can parents get it right for their kids and encourage good habits that last into their later years? Basic dental care is free in New Zealand for children from birth until they turn 18. But there are thousands of children currently on waiting lists for dental treatment. We're talking serious surgeries in some cases, which require them to go under general anaesthetic. Sugar consumption, a significant contributor, along with a lack of visits perhaps to dental care along the way. Oral Health Promotions Manager at the New Zealand Dental Association is Anishma Ram. Morning, and thanks for being with us, Anishma.
Thank you so much for the invite.
What's the
It's
earliest?
good to be here.
Yeah, great to have you with us. What's the earliest perhaps parents should be thinking about dental care? Should there be some things on their minds even before baby has teeth?
Yes. So one thing I suggest to most of our parents and patients is that you start cleaning a baby's mouth as soon as you start washing them, because they're still eating. They're feeding. So when you're washing a baby, you should be starting to clean their mouths. And in that way, you are wiping off the milk residue. And in turn, you're massaging the gums for the teeth to come through. So that will encourage it when you will actually start the brushing process. Because some of the biggest issues we find with children is that parents are struggling to get the brushing behavior introduced because the child does not want to brush their teeth. They're struggling to get it done, and it's just all too difficult. So one way in which you could start this process is by actually starting is more of a life skills thing. So if you're washing them when they're a baby, then you clean their mouths as well. And then once they start having their teeth, then you can transition into a finger brush, like a silicone finger brush or something of that sort.
What do you mean by wash their mouth? Do you mean the gums themselves?
The gums,
You
yeah,
just do
it's
that
the
very
gums.
gently, one imagines.
Yes,
You want to look after
yes.
your own hygiene and make sure you've got clean
course.
hands, etc.
Yes, yeah. So what I suggest, like in my culture, it's a very common thing. So when we wash a baby, we will wrap our flan around your finger, and you will just go around very gently around the gums just to wipe off the milk. I don't know why grandmothers used to do that. Maybe they didn't know it was supporting dental care, but that's actually quite helpful. So you just remove the milk residue from the gums and the tongue, nothing too extreme. So it's just very gentle, and then you can go ahead and wash them the rest of their body. In doing so, you are letting them know that this is an area that needs to be cleaned. So when at the age of 6 months or even at the age of 1, if we're trying to get a brush in there, it's not foreign.
All right.
Yeah, it's not a foreign material.
Let's talk about teething issues perhaps.
Yeah.
And first, what to expect. What can help with the pain, but also what are you expecting as those teeth are coming in? Obviously, babies can be very irritable during this time. But what are you looking for to be happy with the way it's happening?
So usually, look, it's quite it's quite a funny scenario here, because some children will exhibit nothing at all. One fine day, a tooth just comes through, and then some kids will have all the issues under the sun. Like they could have something like mild temperatures. They would be quite grizzly and crying. So if you have a normally happy baby and they cry and drizzle, drooling a lot, and some of them have red cheeks, anything around mild temperatures is okay. Or they have a sudden desire to bite or chew, bite on textured object, or just they just want to bite you or something else. That's when you actually know that there could be teething. And some of the things that we suggest you could use, we all know that Bonjela is available as an over-the-counter drug. Apart from that, you could have like something around an ice cube wrapped in a flannel or something, and you could gently rub them around gums. What I used to suggest to my patients is that freeze pieces of fruit, put them in a flan and get the child to chew on it. So that just helps massage the gum and just helps calm the child down. Pemo also helps.
Once the teeth are arriving then, what happens? Is it called eruption time? Tooth eruption is a fascinating way of putting it, isn't it?
Yes.
How are you caring for teeth once they are coming through the gums and it's all on?
Okay, so before I go on to the next one, just something else that I would like our listeners to know, that if your child is having vomiting, diarrhea, or extremely high temperatures, that's not a sign of teething. Please don't think of it as that and stay home with it. You need to call 111. That's not normal sign of teething. And onto the next questions, which was when the
Once the teeth are coming through, yeah.
yes, how do you manage it?
Yeah,
Is it?
exactly. How do you manage it? And then also the care again for the teeth as they emerge, erupt and come through.
So going back to my first answer that I did, if you had started the cleaning of the gums from when they were babies, I don't expect you to do it when they're like 1 day old, but when you feel confident, when they're babies. So as soon as their first teeth start coming through, we would suggest you continue cleaning the gums. So you could either then transition from your flannel wrapped around your finger to actually one of those silicone brushes that you can stick on your finger. It wasn't available in my time when I had children, but I think it's available now. And you can use that to brush the baby's teeth. But I would still suggest massaging the rest of the gums around the mouth that haven't had teeth come through. So it will just stimulate the process. You could transition into a little brush with a small head, a soft brush. And you can start cleaning that. And as soon as you have your teeth, the babies have your teeth, we need to start brushing them with a low dose fluoride toothpaste. So we actually have those baby formulated ones available. We should start doing that, yeah. And if all of them are not working, suppose your child is not managing with any of them, then you can even wipe that one or two tooth with a clean cloth dabbed with a fluoride toothpaste.
Just on the teething, you mentioned frozen fruit, perhaps. Babies, they like people used to use rusks a lot. You know, they like to get those irritating new things they have into action, don't they?
Yes.
What other kinds of things? I think some people have toys also, just called toys. What do you recommend? What do you not recommend?
So I would stick to what I said, and I would stick to, if you're going to buy a teether that most people do, make sure it's not a fluid filled. Because
Right.
if the fluid, if it ruptures, then we have other issues. So I'm not really a fan of you getting on something hard or something random that's not probably clean or probably sterile. So that's why we have those teething rings and stuff. But just being careful about which ones we select, and you make sure you clean them properly before you put into your child's mouth and stuff like that. Yeah.
When we're getting into brushing, I know my dentist is always telling me off for brushing too hard. I think that's because I take life's frustrations out on my teeth sometimes. And you must, I imagine you need to be very careful of this with children. How gentle do you need to be, particularly with those,
The
baby teeth, yeah?
I mean, as gentle. I mean, hey, if you are brushing it too hard, the baby will let you know anyway. But I just feel like in this way, the silicone brushes, I think they are a lot more gentler than the normal bristle brushes. And also sometimes I just used to use a cloth around my finger. I'm old school, and then I just used to be, because then I could feel how hard or how soft I am on their gums and teeth, and then I felt like I would know if I've cleaned it well. Does that make sense?
Yes.
Yes. But then your child could go around and bite your finger. So then, yeah.
There is that.
Yeah.
Okay. When do parents move away and perhaps encourage a child to brush themselves, have a go themselves? How young and how long might some children need help with it?
So around the age of 8 is when your dexterity sort of starts to develop. So you would still be brushing your child's teeth, or just having that core brushing where you are brushing them and you're letting them brush afterwards, so you know they're doing it right. And then around the age of 8, you kind of allow them to do it independently. Some children may need to be watched until a little bit later. Look, I've got a 17-year-old and I still go in there and I'll be like, show me if you've been doing it right.
He's got you for a mum.
Yeah.
He's got no chance of escaping it. No. Wonderful. Well, you're doing him a favour. What about flossing? At what age? Dentists, again, are very big on flossing, and I know there's good reasons for this. And just explain what they are, by the way. It's not just for the decay factors, it's for other things as well. But at what age might you introduce children to flossing? Because it's pretty complex.
So, I know of my friends who are doing it for their kids when they're as young as 2 or 3 years old. So as soon as you think they're comfortable with it, like I would get the brushing regime sorted first. If I would have my child now, they know how to brush their teeth properly and they're comfortable with me, if my child is comfortable with me brushing their teeth. So even in preschool age, you can start the flossing, because we actually have quite a lot of young children tend to have very tight contact points, and sometimes it's very hard to get the brush in and clean it as effectively. So we do encourage parents to start flossing their children's teeth as early as they possibly can. I'm not saying in an 18-month-old or 2.5-year-old, but if you think your child is not confident and they will allow you to get the floss in there, that's fine, you should start. And the best ones are usually the stick ones, like, we've got the traditional string floss that you sort of wrap around your finger, and if this was visual, I would have actually shown you how to do it. But it's more of a technique, and trying to get a child to open their mouth and you're trying to fiddle with some string around there, it just seems like a lot of admin issues there. So getting those stick flosses, you can get at the chemist warehouse, you can get at the supermarket, where it has like a bit of a string in a piece of stick, and you can just go in between your teeth.
Okay.
And you can hold it for the child. And again, I suggest from 8 years onwards, the child can floss themselves, but before that, the parent needs to help.
How can good habits be bedded in? Teeth brushing is a family activity or part of the bedtime routine, right? Go and get your jammies, we may or may not have a bath, and then we're doing our teeth. Are those routines shown to stick for life if you can make it part of it?
Well, something that we know for children is like the earlier you start a habit, the better it is embedded. So it's just like showering. I mean, to shower in the morning, maybe or at night or whenever, because it has been something that has been embedded, shown to you to be doing it. We wash our hands. So similarly, if a brushing habit has been embedded at the very beginning, that's why I had said when you have a newborn baby or you have a new baby, you start cleaning then. So it sort of gets embedded from there. But I found that something that really helps is modeling. So if they see you do it, they will want to do it. So modeling a behavior is it's actually a good way to getting it done. If you have older siblings, getting them together, the kids in the bathroom together, or with yourself and the child, and they can just brush their teeth together. They tend to help sticking with the habit.
All right. Let's look at some things that can go wrong with teeth arriving or otherwise, and that can be a value judgment. I know we've done interviews previously about cosmetic versus actual needs when it comes to a lot of correction that's done. But what are you on the lookout for at various stages with children where there may be a problem with teeth? What kinds of things might you keep an eye out for?
So one of the things that I would recommend is you lift the lip. So that's why we encourage parents to do the brushing for their children, because when you're brushing or when you're cleaning, you're actually looking around. So when you lift the lip, and so we've actually got a good resource, and I'll give details about that. When you lift the lip and you see something other than the natural color of teeth. So it's not normal for your teeth to be pearly white. That's not normal, right? They actually have variants of colors. Some are pale yellowish. So what we don't want is sometimes children would have freckles of what we call a hypermine. So it has speckled white looking, or it has brownish issues, or they simply have some missing portions of the teeth are missing, or a black sort of stain or something on the teeth. So it's just you're lifting the lip and you're seeing it. If it looks any different from the adjacent tooth, what this one looks like, then maybe you need to consult us. But it's quite hard to tell you about it on the radio. Maybe it's easier to show. So what I suggest people to do is go on our website. We've got some resources on Lift the Lip. So they are stages in which we identify what is okay. So you have a nice clean mouth, and then you will have maybe chalky lines around the gum margins, or sometimes you will have a dark or speckled look around the gum margins, or in your back teeth when the child opens the mouth, if you're starting to get heavy staining in them and sort of this brownish looks that is it's to be honest, it's a little bit difficult to explain.
We'll put the link up. Put the link up. There's a few questions coming through now. And obviously there are dental vans or buses coming to most schools, although I know there is a real issue with equity and availability at at having professionals actually assessing how kids' teeth are going over time. What we haven't talked about is some of the preventative stuff. I've got a question about dummies and your feeling on their use, and if so, for how much and for how long. But of course, we know also other issues. Sadly, again, it's to do with how cheap sometimes fizzy drinks are compared to something that's much more healthy for you. What are the other things to be really mindful of about what is not good for young teeth?
So what is not good for young teeth? So obviously good nutrition is good for young teeth, right? And you want to ensure that your children. So what I suggest to my patients is that I would rather not introduce the sugar. They will learn about it anyway. So if you can refrain from introducing sugary treats along the way all the time, that sort of keeps them at bay. Because if a child cannot clean their teeth properly, if you are unable to brush their teeth at night and they are given the sugary treats and other things, then you're not really enabling them or helping them. Sorry, you're not actually helping them at all. So limiting treats to meal times only, that's one thing you could do. So if you have introduced sugary treats to your child, that's okay. But limiting them to meal times only is probably where we are going at. Everybody's allowed a treat, but we should not be having packets and packets of sugary treats all the time.
What about constant snacking, asks this person. They're saying, and they're not saying what the snack is, but they're saying that I've heard it doesn't give the mouth a chance to self-clean. Can you tell me more?
Yes. So we've got something called the saliva. It needs about 30 minutes before it returns back to its original pH level. So the pH basically is our mouth sort of sits around 5.5, 6.5 pH is for it to help the teeth be in an optimal stage where they can be remineralized from the fluoride from the toothbrush. So what you need to do every time you have a sugary rinse, the pH goes down. Sugary rinse or a snack, so the pH of the mouth goes down, and it takes the saliva up to 30 minutes to bring it up to the optimal level where it is in balance. So what happens when the pH of the mouth or the saliva goes down? So that allows for what we call demineralization to happen. That means the minerals from the teeth start leaching out, and ultimately if that continues to happen, that's where dental decay happens.
All right, one more question. Should we be cleaning or brushing the tongue as well with children?
Yes, we should be, because if we eat, think about it, if you eaten, you've got food on your tongue as well. You've got bed bugs and other things on your tongue. So when you're cleaning your teeth, you need to be cleaning your tongue too. Yeah. And some studies say that's where the bugs that cause bad breath also live in. So that actually helps.
Would you come back another time, Anishma? I know there'll be questions about braces and about other kinds of treatments to deal with where there are issues. I'd be truly grateful if you'd come back another time, because I think people would appreciate that. But thank you so much for your time today.
Thank you.
Thank you. Come back and talk about adolescence, says someone. Let's get into them next time. Thank you so much, Anishma Ram, who is Oral Health Promotions Manager at the New Zealand Dental Association.